Actually, malignancies during pregnancy are not uncommon. They happen up to 1 to even 5% of the time. Breast cancer is the most common, but also melanomas, lymphomas, leukemias, and any cancer really can happen in pregnancy except for prostate cancer. I guess I'll make that joke. Often there is a history of cancer, so the pregnancy needs to be followed, for that risk. But also often cancer can happen during pregnancy, so you can be diagnosed when you're pregnant, 10 weeks, 20 weeks, 30 weeks, with breast cancer, with melanoma. And those are much more difficult to take care of because sometimes you need surgery, chemotherapy, radiation therapy, and that can be sometimes dangerous for the baby. The most important issue to say to the patient, to the oncologist, to the obstetrician like me is think first how you would treat the lady if she were not pregnant. That's how you should start. You should start thinking what's the best therapy for the mother, because obviously you need the mother to be alive and well for the baby to do well. So that's what we tell oncologists, medical oncologists, surgical oncologists. How would you treat her? 95% of the time you can actually use the same treatment. Because while chemotherapy, most of it crosses the placenta, it's usually safe, especially out of the first trimester. So wait till 12, 16 weeks, and then you can treat the woman. In severe cases, sometimes you have to think about interruption, but 99% of the time, you don't have to do that. You can actually treat during pregnancy, treat the same way as in a non-pregnant woman. So that's an important message. Think first how you would treat the pregnant lady as if she were not pregnant, and then make the pregnancy adjustment. I've been doing this for 30 years. I've seen many, hundreds of cases of cancer, and usually the woman survives and the baby does well. It's very uncommon, for example, that cancer goes to the baby. Only, for example, melanoma sometimes can go to the placenta and rarely to the baby. That I've seen once or twice in a long career. So most of the time, women do really well. You can actually up the therapy after pregnancy. Sometimes you need to deliver the woman a month or two earlier. So if there is a chemotherapy that you cannot use during pregnancy, you can use right after the delivery, postpartum.